So if it's in the Premier's court, and the Premiers are saying the Prime Minister will meet with them, and the healthcare system's in a crisis, and as you acknowledge, the hospitals are in a crisis, what's the short-term solution to give any of these hospitals that are turning away patients or, transferring patients elsewhere some relief? Can the federal government do anything right now in the short term?
Well, the federal government, as I said a moment ago, has been sending, is sending, and will be sending very significant additional resources to support the difficult work of my colleagues, health ministers. Their job is not easy with the viral situation of which Dr. Tam spoke a moment ago. It's very difficult in hospitals and in healthcare contexts across Canada. So my job is to be an ally of health ministers, to make sure that that significant and additional funding that our government has been committing to is being received by health ministers. And that's the case with the $2 billion just recent investment in supporting our healthcare system, and more particularly hospitals, in the context of backlogs of surgeries and treatments. The equally important work that we need to do together is to look at the longer term. Our healthcare system has been under severe demographic pressure over the last few years, and over the next few years it will be under increasingly heavy demographic pressures. And to do that, to address that pressure, we need to have a more modern healthcare system, a healthcare system that invests, for instance, in sufficient access to family health teams. A lot of our patients now end up in a hospital because they don't have a family health team to go to. Or they end up in a hospital because, not having had an access to a family health team, they end up with more severe health conditions, and then it becomes a lot more complex and a lot more difficult and much more costly, and unfortunately a lot less good in terms of health care and health conditions, to end up in the emergency department as opposed to having been able to visit a family health provider prior to this. In addition to that, as I said a moment ago, it's about data and modernizing our healthcare system, making sure that safe and appropriate information on patients is accessible by healthcare providers, and investing in home care and mental health care and long-term care, as we have promised to do and as we're doing now.
So, but you're saying the health ministers that you meet with agree with those reforms and changes that need to happen to the system. However, we're hearing from the provinces that they want to meet with the Prime Minister. They want to move forward on getting the healthcare transfers increased. So what's holding this process up? You're blaming the premiers. The premiers are blaming the Prime Minister. Where's the truth?
Well, premiers have important responsibility. Health ministers have an equally important responsibility, and we need to be given the room to take on that responsibility. We were able to do that. We were prepared to do that, and we were hoping to do that in Vancouver just a few weeks ago. Unfortunately, the premiers asked us not to do that work.
Sir, what can't you share, though? I'm confused. What is it that you can't share? The premiers aren't allowing you to share. I want to make sure I'm hearing you correctly. The premiers are forbidding the health ministers that you spoke with and have an agreement of some type to move forward with, not to share. Am I overstepping that? Am I misunderstanding something?
Yeah, as you said, and as you heard earlier, there were two key plans, one on supporting health workers and one on modernizing our health system, including having a modern health data system in Canada. We were prepared to approve those plans and to make them public, but we were asked by premiers not to do so.